Alright, Shalom. First and foremost, I would like to give all the honor, glory, and praise unto Yahweh, Bahashem, Yahweh Shai, Bahashem, Rakakodash. Alright, double honors and respect to the elders and to the apostles of the great millstone. Peace and blessing to all Akim that are preaching and teaching this word with 100% truth and sincerity. And unto the men, women, and children that are listening and learning. And unto the Ba'ath, the Dabadah, the elect house of David that is scattered abroad, I give you my utmost and sincere salutations. Okay, so, something of the spirit just hit me, and I was scrolling around on YouTube, and I came across a post from 21 Studios where they talk about, how to be a masculine man and how to break away from the system of feminism. And they said something along the lines that having foreskin on your rod is natural and it shouldn't be taken away. Well, the scriptures say otherwise, and then I stumbled upon this video. And basically this doctor here is going to go into the pros and cons of circumcision. So the name of this video is why circumcision is a bad idea. So we're going to go ahead and get into this. Video is a little bit more than 7 minutes long, but after it's over, I'm going to get a few scripts, and then, Lord willing, to be edifying unto the body and to those that are new coming and listening and learning. So let's get started.
The debate surrounding circumcision is literally older than the Bible. It's thought to be the world's oldest planned surgery, and it actually predates recorded history. In today's video, I will not be settling this discussion, but I will provide you with medical arguments for and against circumcision. It's up to you to draw your own conclusions based on the available evidence. So make sure to watch the whole video so you don't miss any important information. For those of you meeting for the first time, my name is Raoul. I'm a medical doctor from the Netherlands, and it's my mission to medically educate you so you can make healthier decisions. So let's get learning. So before we dive into the arguments for and against circumcision, it's important to discuss and explain what circumcision actually is. It's a procedure where the foreskin, which is the skin covering the tip of the penis, is removed from the penis. In first world countries, this all starts with a doctor's appointment. You go to your doctor, and your doctor will explain the benefits as well as the dangers of circumcision. He will explain the surgical procedure, and when you agree, the circumcision can be planned. Fast forward to the day of the procedure, then the first step is disinfecting the penis and the surrounding area. Afterwards, an anesthetic will be injected into the base of the penis, or it will be applied on the penis as a cream. Next, the foreskin is extended with a forceps, after which it will be surgically removed. This procedure will usually take about 10 to 20 minutes. Afterwards, when it's all done, the penis will be covered in petroleum jelly as well as antibiotic cream, and it will be bandaged. Furthermore, it will take about 7 to 14 days for the penis to heal. The tip of the penis will likely be sore at first and might look red, swollen, and bruised. So be careful to avoid putting pressure on the penis, especially the first few days. In addition, it's safe to wash the penis after the procedure, but do not go for a long bath or for a swim these first few weeks. It's also often advised to frequently reapply a dab of petroleum jelly on the tip of the penis. It's also important to know that complications from the surgery might arise, and in these situations you should contact your doctor. So if you can't pee within 12 hours after the circumcision, if you experience persistent bleeding, or if you experience a wound infection, then please contact your doctor. You might have a wound infection if you experience a fever, if you have increased amounts of pain, if the penis is red or swollen, if the penis throbs, and or if there is a foul-smelling drainage from the tip of the penis. So we all know now what a circumcision is, but you might wonder, why is it performed? Here it is important to know that about half of all circumcisions worldwide are performed to prevent future medical problems. This is called prophylactic healthcare. You see, circumcisions are associated with a reduced risk of certain sexual transmitted infections, certain urinary tract infections, as well as it reduces the risk for a specific rare type of penile cancer. This also includes cancer-causing forms of the human papillomavirus, HPV, and it strongly reduces HIV transmission among heterosexual men within a high-risk population. It's actually so effective that the World Health Organization recommends circumcision as part of their HIV prevention program. They recommend it mostly in high-risk areas, However, the effectiveness of using circumcision to prevent HIV in the developed world is still unclear. In addition, circumcision could also be used to treat other medical problems like phimosis. This is a medical condition for a foreskin which is so tight that it's difficult or impossible to retract. As you can imagine, this could lead to inflammation of the penis in the long term. Luckily, this is a problem that could be solved with circumcision. The same is true for men dealing with chronic urinary tract infections, as circumcision can also lower your chances on developing new urinary tract infections. The last medical reason for circumcision is that it makes it simpler to wash the penis, which increases hygiene levels. Besides medical arguments for circumcision, there are of course also social, ethnical, religious and cultural reasons for circumcision. It's especially common among certain Jewish and Islamic families, as well as certain Aboriginal tribes in Africa and Australia. Which brings us to my favorite procedure, which is asking you to click the like and subscribe button. No, all jokes aside, these videos cost me a lot of time and effort to make, and I hope you'll learn a lot. If you do, then please click the like and subscribe button. This will help out the channel tremendously, and in return you will get a notification each week for a new awesome video. It's free, you can always change your mind. Let's continue. So, circumcision can make a lot of sense in some situations. However, every advantage has its disadvantages, and it's important to know the possible risks and dangers so you're properly informed. First of all, circumcision is regarded as a safe procedure when performed in a sterile clinical setting, in a hospital, by an experienced surgeon or a urologist. Nevertheless, when performed on babies, there still is a complication rate of about 1.5%. For older children or adults, this is even close to 6%. And these percentages get even higher for circumcisions which are not performed in a hospital by an experienced doctor. Common complications can be persistent bleeding, an infection, removing too much or too little skin, and a stenosis. A stenosis is an abnormal narrowing of the tube through which you pee, your urethra. This narrowing could lead to difficulties peeing, which ultimately could to urinary tract infections and kidney problems. This is the reason why most European medical organizations consider the benefits of a circumcision not worth the potential risks. In addition, in older children or adults, this procedure often needs to be done under general anesthesia, further increasing the risk for complications as well as lengthening the time which is needed to recover. Which brings us to the conclusion. There are some health benefits from undergoing a circumcision, but it can also cause certain complications, and the rate of these complications get higher and higher the older you are. In addition, cultural and religious motives are often also very important when making the decision if circumcision is right for you. And lastly, keep in mind that circumcision does not affect your fertility nor the sexual pleasure you might experience. I hope you know everything you need to know now about circumcision, but if you have any questions left, let me know in the comment section and I will do my best to answer each and every one of them. For those of you that can't get enough, check out the Instagram as well at HowToMedicate, or check the playlist with more awesome medical videos in the description. If you did enjoy the video, if you did learn something, then it would mean the world to me if you click the like and subscribe button, and in return, you will get a notification each week for a new awesome medical video. I will see you next week with that new video. Bye bye.
Oh, excuse me there. So we're gonna look at some
The debates.
We're gonna look at the benefits for circumcision and the risk here. Okay, let's see. Okay, and the benefits for circumcision include less risk of urinary tract infections, a reduced risk of some STDs in men, protection against penile cancer and lower risk of cervical cancer in female sex partners, prevention of balanitis, inflammation of the glands, and balanopostitis, inflammation of the glands and foreskin, prevention of phimosis, the inability to retract the foreskin, and paraphimosis, the inability to return the foreskin to its original location. Circumcision also makes it easier to keep the end of the penis clean. Note, some studies show that good hygiene can help prevent certain problems with the penis, including infections and swelling, even if the penis is not circumcised. In addition, using a condom during sex will help prevent STD and other infections, but the Bible says you have to be circumcised. We're going to get them in a second. These are the risks, which include pain, risk of bleeding and infection at the site of the circumcision, irritation of the glands, higher chance of meatitis, inflammation of the opening of the penis, and risk of injury. So, all right, now we're going to go to the book of Genesis, chapter 17, verse 10. And it says, "This is my covenant which ye shall keep between me and you, and thy seed after thee. Every man-child among you shall be circumcised." Verse 11, "And ye shall circumcise the flesh of your foreskin, and it shall be a token of the covenant betwixt me and you." Okay? So it's a commandment. Okay? It's part of the covenant and the law, and it's a commandment that every man-child, being 8 days old after they're born, is to be circumcised. Okay? It's part of the law here. Verse 12, "And he that is 8 days old shall be circumcised among you, every man-child in your generations. He that is born in the house or bought with money of a stranger, which is not of thy seed." Okay? And, when, the kingdom is established here on earth, and the heathens are going to be forced to follow our ways, they're going to have to be circumcised as well. Because they're going to, the law will be enforced. And this is part of it. And those that are not of your house or not of your seed, they will be circumcised. Verse 13, it says, "He that is born in thy house and he that is bought with thy money must needs be circumcised, and my covenant shall be in your flesh for an everlasting covenant." 14, "And the uncircumcised man-child, whose flesh of his foreskin is not circumcised, that soul shall be cut off from his people, and he hath broken my covenant." So, being an Israelite man and being in this truth, you have to get circumcised. There's no what ifs, ands, buts, or what's about it. Okay. Now we're gonna go over here, and it says this is why does the person be circumcised on the 8th day? And it says here, according to evidence here, it says the human body has 2 blood clotting elements. One of them is called vitamin K. Vitamin K is not formed in the body until the 5th to the 7th day. The second clotting factor, which is essential, is called prothrombin. It is surprisingly enough develops to 30% of normal by the 3rd day of the life. After that, peaks at 110% of the 8th day, just before leveling off at 100% of normal. If vitamin K is not present when a baby boy is circumcised, the baby will bleed to death. Okay, and the reason why you have let's see here. So it says here the reason why Yahweh, even though it says Yahweh there, but we know that's a false name. Yahweh established day 8 for circumcision is that vitamin K peaks in a newborn at 8 days of age. The 8th day is the optimum day for circumcision because the highest presence of the clotting factor, vitamin K. Today, when baby boys are circumcised within a couple of days of birth, they are administered vitamin K to help with blood clotting. Okay. So that's about it on that. Let's see. Oh, and let me get Leviticus. It's going to be the book of Leviticus, chapter 12, verse 3. And it says, "And in the 8th day, the flesh of his foreskin shall be circumcised." So when you have a male child, on the 8th day after his birth, he needs to have the foreskin removed. And going back to Genesis, the 21st chapter, when Moses circumcised his son Isaac. Okay? Genesis 21, verse 4. And it says here, "And Abraham circumcised his son Isaac, being 8 days old, as Yahweh had commanded him." Okay? So, this is a commandment. And like I said, yeah, like, what this guy said about, there being, risks and all that, going back over here, the benefits and all that, and, irritation, risk of bleeding, infection, and inflammation, risk of injury. Well, yeah, that's only if you're in the hands. Yeah, that's only if you're in the hands of a doctor who don't know what he's doing. But ultimately, the Bible tells you that circumcision is a requirement. Okay, because if you do your research, and I've looked up some of the things that, if you're uncircumcised, that foreskin can cause, like I said, UTIs, infections, urinary buildup that's backed up. It can cause a lot of, like I said, being uncircumcised can cause a lot of problems. That's why it's best that, you get get the foreskin removed. Salakia, this thing is acting up. But other than that, I hope that this was edifying unto the body and to those that are new coming in, listening, and learning with all sincerity. So, so yes, this is, let me get one more script. I don't know why my internet's doing this, but yeah, it's just weird. But I know that's Satan. He's messing with my internet here, causing things to freeze up, so I can't get this lesson out. But this is going to be the book of Galatians. Galatians chapter 5. I'm going to start at verse 2. Galatians 5 and 2. It says, Behold, I, Paul, say unto you, that if ye be circumcised, Hamashiach shall profit you nothing. Verse 3. For I testify against to every man that is circumcised that he is a debtor to do the whole law. Okay, so when you use circumcised in this scripture, it's talking about being circumcised in the mind as well as the physical flesh. So even if you are circumcised, if you're not following the law, the law, statutes, and commandments to the best of your ability like you're supposed to, Hamashiach shall profit you nothing. So yeah, you're circumcised, but if you're not doing what is required of you of the law, you're not, the circumcision is void. And you're circumcised in the flesh, but you're not circumcised in your mind, putting away spiritual impurity and iniquity. Okay? So I'm going to read verse 3 again. For I testify again to every man that is circumcised, that he is a debtor to do the whole law. And a debtor meaning you are obligated to follow the law. Okay? We have to follow the law to the best of our ability. No questions asked about it. So, again, being circumcised in the flesh, it's a commandment. And, we went over a few things about it. So I hope that it was edifying. And I'd like to give all the honor, glory, and praise unto Yahweh, Bahashem, Yahweh Shai, Bahashem, Rakakodash. Double honors and respect to the elders and to the apostles of the great millstone. Peace and blessing to all Akim that are preaching and teaching this word with 100% truth and sincerity. And unto the men, women, and children that are listening and learning. And unto the Ba'ath Dawadah, the elect house of David that is scattered abroad, I give you my utmost and sincere salutations. And another thing too, personal hygiene is also another factor that plays into, keeping yourself clean from getting infections and inflammations and all that. So, and that's another thing I'll get into in the Bible later, Lord willing, about hygiene. But see y'all in the next lesson. Kwam Yasharala, Wa Baba Ba, Shalom, Barakatham.